As we look to the future and life after COVID, we have so many questions. How will healthcare continue to change? Are we more prepared if something like this happens again? Here's an example of one hospital letting science answer those questions.
I think we all want the same thing, and that is we would like to get back to a pre-COVID state so that we can go back to our regular business before our lives were so dramatically impacted by COVID. We've been involved in multiple different studies, both in treatment modalities as well as understanding the outcomes from this disease, how it affects different populations, and potentially what the long-term effects are. It seems like we have a new study starting on COVID, at least one a week, and sometimes it feels like one a day.
This is a pandemic of tremendous magnitude. It's 100 years plus, and we have learned very, very quickly. Imagine we now have treatments and therapeutics that weren't even thought of back in February or March at this point in time. So we are definitely moving quickly to manage this virus.
Our response to the infection as a form of the treatment has tremendously changed at this moment. There are newer drugs, there is introduction of things like steroids, and new antivirals had made the mortality really, really low. There's definitely a role of comorbidity, especially hypertension and diabetes. But we also seen that individuals who are young and healthy, they're dying of the disease. We're trying to answer one question. Is there something in our genome which is making us respond to the virus differently? If we can crack that code, that will help us identify those individuals quicker, faster, and then give them the vaccine earlier to make sure that they're not infected.
The Regeneron study is known as the cocktail study. This is not an oral drug, this is actually an IV drug. And by cocktail study, what that means is it's actually two antibodies together. The reason we give these two is just in case the virus has mutated, right? And the purpose of the antibodies is actually to block the virus from adhering to the body's tissues and receptors. We have an inpatient study for patients that are more severe, and we're just now starting an outpatient study. The hope is that a lot of those patients that are in the outpatient setting will not have to be readmitted to the hospital 5-10 days later with severe COVID. We also have a new study just starting up with a brand new antiviral pill that has activity against the coronavirus. You can imagine how nice it would be to have a pill that you can give in the doctor's office or you can give in the emergency room instead of having to admit somebody for even an IV dose of an antiviral antibiotic.
Augusta University Health, Augusta University, and the Medical College of Georgia have a long history of studying health disparities and trying to close the gap. We're doing the same with COVID, and we'll continue to study this disease and how it disproportionately affects those populations so that we can close the gap there as well.
Not only have we concentrated on the biological aspects of it, but we have also tried to work out the psychological and sociological aspects of it, which have become very, very important in a pandemic, right? We know that kids and older adults have higher rates of depression, higher rates of suicide, higher rates of overdoses. A lot of individuals have lost their jobs, and because they have no income, they have no resources, and they have problems obtaining medical care. So we've really a three-pronged approach in taking care of COVID, specifically here in the Augusta region.
So the next stage of our work is identify frontline workers, anybody in community who's constantly exposed to individuals on a daily basis without knowing their status of COVID-19. We're trying to answer two questions. Number one, what kind of antibodies are these individuals making? How long these antibodies stay in your body? And the second thing is, do these naturally occurring antibodies in these individuals prevent reinfection? Then we'll go back and study their T cells and B cells and how these super antibodies are produced and use that understanding and knowledge in vaccine development and vaccine making.
We are leap years ahead of where we were when we had no clue what to do. I think, bar none, we definitely are at the cutting edge of diagnosing COVID infections, managing COVID infections, and treating COVID infections.
These things will take some time, but definitely there's light at the end of the tunnel.
It kind of gives you an idea that we can get through this, and we'll get through this together. And we can then, with our research, then expand and help the rest of society, really.
Whether you're one brand of the health system or another, I think we've all recognized that we have to pull together to create the best system that we can to provide care for these patients.